Hi friends, I am Sutar sir. I am going to give you a lecture on hepatitis C. Friends, you know that what is hepatitis C? Mostly hepatitis is nothing but jaundice is there that is well known. Regarding that, in case of the jaundice, we have to be observed that the patient is having a yellowish color body on his uh, yellowish color body, whereas the eyes are there, nails are there, as well as the skins are there that is to be showing a yellow coloration. All where the hepatitis is there that shows the such type of the symptoms are there. But hepatitis C is a major disease is there because hepatitis C is mostly occur because of the virus hepatitis C virus. Hepatitis C disease is there is a very dangerous disease is there. In case of the hepatitis C, there are the two types are there, acute as well as chronic. Whenever the patient is there, he should be suffer by from the last few weeks, that is the illness is there or the tiredness is there, that related to your hepatitis C virus is there. And in case of the acute hepatitis C is there, if sudden or the severity of the hepatitis C is there is occur that results in case of the liver cancer, and ultimately the death of the patient is definitely in case of the hepatitis C. We see that here the patient is there is suffer by hepatitis C. It shows the yellowish color on his color. You can clearly see that the face there is having yellowish color. Eyes are there that are having yellowish colors are there, which is to be observed. Now the symptoms are there, that is a fatigue is there, then nausea is there, mild fever is there, yellow color skins are there, stomach pains are there, and the dark urine is there. We have to be observed. When the severity of the hepatitis C is goes on increasing, how it shows means what are the levers is shows we see in this one particular diagram. This is the one is there where the normal liver is there is to be shown, whereas the second one is there, that is the hepatitis C, means the attack of the hepatitis C is there is to be found on this one liver, that is a whole liver is there. So that indicate that the severe problems are there which are to be observed, and the liver is not able to cure by any means, and last stage of the patient is there, that is the death is there. This is about hepatitis C virus is there. Now you know that how the hepatitis C virus is appear. Now let's we see that hepatitis C. Now this is the hepatitis C is there that is to be appear, that is a liver disease uh, is there which is to be mostly affect on the livers is there. And in the last slide we see that whenever the hepatitis is there is to be increase severity, then it shows such type of the liver is there. Then in this one liver, these are the stages of the livers are there. This is your normal liver is there. Whenever this one liver is get infected by hepatitis C, so you have to be observed that your wall is there, that is a tough one and is having a full strain. Then sharpness in there, that is you observe. But when the hepatitis C virus is attack on your liver, it shows somewhat the structures is there or somewhat rigidity is there. It should be observed along with the patches, or we can say that circular patches are there that are to be observed. This is your chronic liver disease, means from the long time the hepatitis is present in your liver, but it is in a dormant stage is there. Then when the fully expanded portion is there, when the full development of the hepatitis is there is you offer, it shows somewhat your liver is to be full of this one particular hepatitis virus and is unable to perform the different type of the function. Now we see that how the hepatitis virus is there, what is the structure of this hepatitis is there that affects on our liver. Um, so this is your hepatitis virus is there, hepatitis virus is there, which is somewhat spherical is there. Then isohedral shape of this one body is there. In case of this one, this is a single strand one is there. DNA is there, that is a single strand is there should be present. In other one, we see that there is a double strand DNA is present, but in case of the hepatitis C virus, there is a single strand DNA is present, whereas it shows a presence of the nucleocapsid. This is your nucleus capsule layer there, which gives protection to this one layer, that is a nucleocapsid if there is present in case of this one. Then it shows envelope is there outside of this one, and to this one envelope there is a glycoproteins are there which are to be present, which are shown one. This hepatitis C virus, it contains a nucleic acid where the nucleus is there should be present in this one nucleic acid. There is a single strand DNA plus RNA is there should be present. Now, how this disease is transferred? The disease is there is mostly transferred. I told you that this is the hepatitis C virus. This is mostly transferred because of the blood products are there. When the patient is there is go on through the various type of the IV treatments are there, or the parental treatments are there that are repeatedly found. In this case, the patient may have chances to suffer by this one hepatitis C virus. Then different type of the blood products are there. That is as a so for example, thalassemia patient is there. In this case, repeated blood administration is there should be required. So that there are the very well chances are there the patient may suffer by this one hepatitis C virus. Some of the diabetic patients are there that are going to take the insulin themselves. So in that case, by this one infected needle, the virus may get entered. And the next one common things are there that are your unexpected sex are there. Means if you are going to perform a sex on with another one person who is there should be suffer by hepatitis C. Then in that case, the transmission of this one hepatitis C there is more. Then unknown community acquired means you are unknown regarding that one particular person that is suffer by hepatitis or not, and if you came in contact with this type of the person and get infected by the blood or the blood products which is oozes out from the wound, then there are the very well chances are there that you may have a infection of hepatitis C virus. Now, in case of this one hepatitis virus, there is a genome structure there is to be present, where there is a capsid is present. There are the two ends are there, three and the five ends are there which are to be found. On this one, it shows the nucleoproteins are there, and then proteases are there, then RNA dependent, then RNA polymerase are there that are to be observed. Along with that, there is a core is there to be present, then E1, E2. These are nothing but your hyper variable regions are there. This variability that she observed in NS2 and NS3 and NS4. These are the stable variables are there which are to be found in case of this one. This genome is a resemble that that is a group of the flavivirus is there that resembles means it shows somewhat the similarity with the flavivirus type of the groups are there that is a genome is there. A positive strand that is the RNA genome of around 10,000 bases are there that are to be observed in case of this one flavivirus. If we consider this one genome strand, a single strand frame structure is there. Structure genes at structural genes are there that are to be present at the end 5 dash. This addition 5 dash in there is a structural genes are there which are to be present, whereas on the 3 dash end there is a non-structural genes are there that are to be present and envelope virion virus. They envelope the virus virion through the 30 to 60 nanometer in diameter. Mean the total diameter of this one virus is there is about 30 to 60. At 5 end 5 dash end there is a structural genes are present, and at 3 dash end there is a non-structural genes are there that are to be present, and it is to be envelop the virus virion and having a total diameter about 30 to 60 nanometer. Okay. Then morphological structure remain unknown. What is the morphology? Means just like other the bacteria or the virus, there are the strands are there that are present or not. This is not to be known regarding this one virus. Then hepatitis C virus has been classified into a total 6 groups. Type 1 to type 6. There are the 6 type of the hepatitis C virus are there on the basis of the genetic analysis are there. Sorry, phylogenetic analysis. On this one basis, there are the 6 genotypes are there that are present. Whereas the genotype 1 and 4 has a poor progenesis. Progenesis means the transmission power of the disease is there which we found, that is nothing but your progenesis is there, and response to the infectory therapy is there which is we found. Sorry, interferon therapy response is there which we observe. In Hong Kong, the genotype 1 accounts for near about 7 cases are there which are to be observed, and genotype C accounts for near about 25% is there that is we observed in case of Hong Kong. Now, the replication is going to be observed that hepatitis C virus replicates exclusively in the cytoplasm. Means it is not to be affecting on the nucleus. Mostly the virus growth is there that is found in case of the cytoplasm of the cell is there. The viral entry is there should be carried out where this one virus, the DNA is there that should be released through this one envelope of this one virus, where this one DNA, the virus particle along with this one virus along some of the virus particles are there that are also found to be goes through this one, where this one are there that are to be translation by the process of the translation and the processing, that are to be converted into the replicative intermediates. Means some of the intermediates are there which are to be formed in case of this one, whereas this one virus particle assemblies are there that are to be goes through this one, and that are to be what are the intermediates are there that are to be assembled, that is the hepatitis C RNA replications are there that are to be carried out. This replicates along with this combined with this one translation process, and then they are to be mixed with the replicative intermediate phase and then form a nucleus. In detail we see this one, the next one diagram is there. In this case here, the attachment initially the virus attachment to this one cell is there should be found, then through this one envelope the virus along with this one core DNA is goes to be enters. Then when it goes inside of this one particular cytoplasm, that is not to be enters into the nucleus, that is to be enters into the cytoplasm, and there is a fusion is there should be carried out, because of which the DNA is there from this one is there, it should be released. Then by the translocation translation mechanism, that is combined with this one endoplasmic reticulum, and there is the alteration in the protein synthesis is there should be carried out, and the replication is there should be found. Then it convert into the membranous webs are there that is found, which are assembled to form a Golgi complex, and then there is a release of this one virus is there should be carried out, and this virus multiply in this way. Such multiplications are there that are to be carried out per day. Likewise the millions of the virus are there that are to be found in our body, and that are going to affect on the livers. Hepatitis C clinical features are there, that is the incubation period is there for this one. Initially near about 6 to 7 week is the incubation period is there, and it ranged near about 2 to 6 weeks is the optimum period is there, where the virus growth is there that is found. Then clinical illness in jaundice is there near about 20 to 30% is there, which ranges near about 30 to 40% is there that is found. Then chronic hepatitis patient is there is to be having 70% is there, means patient there were 70% patients are having this one hepatitis, but this virus are there that are in a dormant condition, they are not going to develop the signs and symptoms. Then persistent infection is there near about 85 to 100% is there. The anyone virus, hepatitis virus is enters into the patient's body, already there are the materials are there that are present, so that in that condition there is a favorable media or environment for the growth of the virus is there should occur, and so that the infection is there should found. Immunity, no protective antibodies are there that are found, and response to be identified. Now, chronic hepatitis C infection is there. The spectrum of the chronic hepatitis C infection is essentially the same as that of the chronic hepatitis B. Means what are the signs and symptoms of this one hepatitis C is same as that of the signs and symptoms of the hepatitis B is there. Likewise, no show vomiting, fever is there. Then loss of the appetite is there. Then what is the urine coloration is there, that is somewhat dark is there as compared to the normal pickles there, that is having a clay like color is there that shows her. All these things are there that should appears in case of the hepatitis B. The same one conditions are there that are also found in hepatitis C. Then all the manifestations, just like your signs and symptoms of the chronic hepatitis B, are same in case of the hepatitis C. It may be seen, but with a lower frequency, that is a chronic persistent hepatitis. Means the attack of this one hepatitis, if there is repeatedly found, means patient feel illness repeatedly, frequently, so that patient it may have the infection of the hepatitis C is there. Then lower frequency is there that you observe. Then chronic, then active hepatitis, then cirrhosis of the liver is there. Then hepato cellular carcinoma. These are the last stages of this one hepatitis C is there. That is a hepatitis carcinoma is the last stage. That is a cancer is there which is found in case of the hepatitis C. Risk factor why this is there should occur, that is a transmission uh, or the transform by the infected donor. If the someone person is having a suffer or he is a carrier of this one hepatitis where he doesn't know, the infected person also doesn't know that he is suffered by the hepatitis C virus, but because the signs and symptoms are there that are not to be found, but if such patient if gives blood to the another one healthy person, then there may be the chances of the transmission of such a virus. Injecting the drug use, some of the patient is having habit to take the injections themselves. In that case, if the injected needle is infected by the hepatitis C virus, then the chances are there the patient have. Then hemodialysis. Mostly the thalassemia patients are there where the blood cells are there that are not to be formed. In that case, ready-made blood is there should be required. So in that case, uh, or the kidney failure patients are there where the filtration is there is not to be carried out. In this case, the hepatitis C virus may get entered in case of the dialysis where the filtration of the blood, the toxins materials are there that are to be removed through the blood. In the kidney failure patient, the hemodialysis there should be carried out. So in that case, the patient may suffer by hepatitis C virus. Accidental injury with the needles or the shaft is there. Sometime by injecting the needles, if same needle is there, if we accidentally goes or pinch to the another one person, healthy person, in that case, the patient may suffer by hepatitis C virus. Sexual or the household exposures of the anti-hepatitis C virus positive contacts are there. Sexual is the one method is there by which hepatitis C virus is there should transfer. In the use of the articles such as the razors are there or the shaving kits are there that is we share. In that case also hepatitis C virus is there is we transfer. Multiple sex partners are there. These are the common source of this one hepatitis C virus is there. Then birth to the hepatitis C virus to the infected mothers are there. Means if the mother is there is infected by hepatitis C virus, and in that case, the what is the infant is there that also get infected by hepatitis C virus. So for the testing of this one hepatitis C virus, there is a hepatitis C virus antibodies are there. When if any one patient is having doubt regarding he suffer by the hepatitis C virus, then in that case hepatitis C virus antibodies are there that are injected. If there is hepatitis C virus that should be present, then there is the antigen antibody reactions are there that are to be found, and depends on that the patient may identify whether it is suffered by hepatitis C virus or not, but it requires near about 4 week time period is there. It is not to be found immediately. This is a major drawback of this one test is there. It is not useful in case of the acute phase, but it is useful in case of the chronic phase. After the injection, before the antibody are there that will be appear. Second one test is there hepatitis C virus RNA. Various techniques are available. For example, PCR, that is a polymerase chain reaction, then branch DNA may be used to diagnose the hepatitis C virus infection in case of the acute phase. The first one takes antibody that is not used in case of the acute hepatitis, whereas the hepatitis C virus RNA is used in case of the acute phase. However, its main use is to monitor the response of the antiviral therapy. Next one is there that is hepatitis C virus antigens are there. ELA, that is the enzyme linked immunoassay. This is the most common test there that is we utilize everywhere to identify the disease. Depends on the causative agent, the disease is there that should be identified. Which type of the disease is there depends on that. Such type of the agents are there that are to be injected. In response to that, if the signs and symptoms are there that are developed, the patient is there should be identified positive or negative. Hepatitis C virus antigen is available. It is used in the same capacity of the hepatitis C virus RNA test, but is much easier to carry out this test. Now, hepatitis C virus RNA, that is a polymerase chain reaction testing is there. In this case, there we see that the virus load, then virus lower detection limit is there, then not for a predicted disease severity is there, like that different terms are there that are to be comes. Now, virus load means hepatitis C virus RNA polymerase chain test is there that is used to determine whether the hepatitis C virus is there is present or not in a blood stream. If the virus is present, the test can also measure the exact amount of the titer in your blood. Means how much quantity of that one agent is there issue present, that is identified by this one hepatitis C virus RNA polymerase chain test is there. Thus, the amount is there is known, that is a viral load is there. Means how much quantity of the virus are present. What is the severity of the virus in your body, that is to be identified by this one. Then lower detection limit, it can be near about 10 to 615 international unit per ml. If we are going to take 1 ml of the sample, then how much quantity of that virus are there that are present, that is to be identified, that is in the range of 10 to 615, that is the normal limit in there, or lower than that, that is to be observed, not a predicator of a disease severity. A viral load does not mean the liver disease is more. It depends on the virus. It is not like that. The disease is the severity of the disease. Means if the virus is more, the more severity is there. If virus is less, then patient is okay. It is not like that. These are the predicators of the disease severity. If there is more or severe, and low viral load does not mean that the patient is okay and does not need therapy. It is not like that. Only that indicate whether it is to be present or absent. Then P helps to predict the response rate to the treatment. If some of the treatments are there that are to be given, then what is the response of the patient to that one treatment is there, whether there is a fatigue condition is there is to be found or not. Such type of the conditions are there that are to be checked in case of this one. We just say higher chances of to cure the therapy. Lower means if the predict response rate to the treatment is lower, means low response is there that is found, or slow response is there, means very well chances are there that are to be cure of the patients are there. Used to monitor the response during the treatment. M is used to response to monitor the treatments are there that should observe in case of this one. Then progenic test is there that is to be used to progenic test is the one that is also utilized. Now what is progenic test? Progenic test is used to predict the patient's likelihood of developing a disease or experiencing a medical event. Therefore, the reference test for the prognostic test is observe the proportion of the population who develop what is being predicted. Means what is the concentration of this one virus, whether they are to be active one or inactive one. What is the likelihood, means patient is there is giving a response to the treatment or not. All these things are there that are to be tested in case of this one prognostic test is there. Then genotype. Genotyping is the one where genotype 1 and the 4 they have a worse prognosis overall and respond poorly to the interferon therapy. Some of the interferon therapy they should be given, and if the genotype 1 to 4 is there should be present, they are having a worse prognosis, the overall response in their therapy. A number of the commercial and in-house assets are there that should be available. So that are to be performed in case of this one genotyping 1 to 4 is there. Then genotype methods are there. That is a DNA sequencing is there. Then polymerase chain reactions are there, such as your lipa one is the test is there that's also performed in case of this one. Then serotyping, that is particularly useful when the patient does not have detectable RNA. Means the RNAs are there that is not to be detected by any other test. Then in that case, serotypes are there that are to be utilized. Viral load. Patients with a viral load are thought to have a poorer prognosis is there. Means if the viral load is high uh, to this one, then it have a poorer prognosis is there. Then viral load is also used for monitoring the response. Depends upon the viral load, the response of the patients are there that are to be defined. Then INF therapy is there. Then a number of the commercial uh, and in-house tests are there that is also available for this one. Viral loads are there. Then treatments, there are the two type of the treatments are there, that is the interferon treatment is there, then ribavirin treatments are there. In case of the interferon, it may be considered for the patient with the chronic active hepatitis, means from the long term the patient is carrying this one hepatitis virus. In that case, interferon treatments are there that are to be given. The response rate is about 50%, means 50% patients are there that are giving positive response, 50% patients are there that are not giving response, because 50% of the responders will uh, relapse upon the withdrawal of the treatment. Means some of the patient, if there is not taking such type of the treatment, so that in that case 50% are there that are giving positive, some are there that are giving negative treatment. And next one is there, that is the ribavirin. There is a less experience in case of the ribavirin than interferon. Means what are the interferon treatments that gives a negative response that is not to be observed in case of the ribavirin. So recent studies are there, or recent treatments are there. In this case, the interferon along with the ribavirins are there that are to be given, and in this case, the more effective response are there that are to be found than the interferon if you have to use alone. Likewise, the treatment is there that should be found. The outcomes of this one hepatitis C virus are there. Hepatitis infection is there, that is 100% are there that are found. Then subclinical codes are there that are to be found in this case, near about 75% are there that are to be caused. Then from this one 75%, the growth of the virus if there issue occur, that is a persistent infections are there, means repeated infections are there that are to be found. Then that results in case of the chronic hepatitis, and then liver cirrhosis are there, and the liver cancers are there. Likewise, the progress of the hepatitis is there issue occurs. Then in case of the acute hepatitis, 25% are there. Then full hepatitis, very rare are there that issue found. And here hepatitis may get cured, but in this case the hepatitis is there issue goes on increasing, that is hepatitis C virus course is there. Prevention of the hepatitis C virus screening, when prevention is better than cure. So how to protect yourself from the intake of the hepatitis C virus? Screening of the blood, organs, tissue, and tissue donors are there. And by chance, if you are suffered by any type of the disease are there, in that case, the operations or the replacements of the organs are there that you found. In that case, you must have to screen that donors whether he or she is suffered by the hepatitis C or not. High risk behavior modifications are there that is also found in case of this one. Then blood and the body fluid precautions are there. Always check the blood or blood products before injecting into your body. Then needles are there, syringes are there, IV sets are there, that you always have to check. Rather than checking, you have to purchase freshly and then that are to be utilized, because prevention is better than cure. In this way, we have completed hepatitis C virus. Thank you. Thank you.